Department of Social Services making progress towards implementing work requirements for expanded Medicaid, which South Dakotans voted for in last November's election.
In a health alert tonight, Grant Green has more on what requirements will be expected for people to stay on the program.
Roughly 2,000 South Dakotans would be taken off Medicaid under the proposed work requirements, but it's all very dependent on what happens at the federal level. The Department of Social Services is close to wrapping up its public comment phase for their work requirement proposal process. The entire schedule is predicated on what is passed in Trump's big beautiful bill. But in the meantime, all input, whether submitted online or testified in person, will be a part of the state's application.
The input that we get both online and from forums like the one that we had today and previously are really valuable. So we'll review each of the comments and figure out whether there are places in the application that it might make sense for us to adjust.
Barring exceptions, Social Services expects roughly 2,000 individuals in the state to miss out on expanded Medicaid if the work requirement initiative, known as SD Career Link, is approved by the Centers for Medicaid and Medicare Services. One attendee of Thursday's public comment session says she has concerns of what will happen to those who are taken off the program.
We can't share our health care. We can't share our prescriptions, our cancer treatments, our surgeries, our visits with the rheumatologist or whatever. So it's fundamental difference. If you lose your health care, it's entirely different from the work requirement for other programs.
As it stands, the department would recognize an individual that has met any of the following work requirements: if they are employed, enrolled in job training, meet the requirements of another work program such as SNAP or TANF, are a parent or a caretaker of a child, elderly, or disabled individual. The work requirement application will be submitted to the Centers for Medicare and Medicaid Services sometime in either July or August of this year. In Sioux Falls, Grant Green, Dakota News Now.